It may not surprise you to learn that taking multiple medications can impair driving. But what if I told you there is a long list of common things we eat and drink that also interact in harmful ways with prescription and over-the-counter drugs? Are you being treated with a certain class of drugs called MAOIs for depression or for symptoms of Parkinson's disease? If so, eating any of these foods, chocolate, aged cheese, Chinese food, red wine, avocados, fava beans, sauerkraut, venison, and certain kinds of fish can cause your body to release large amounts of adrenaline into your bloodstream, raising your heart rate and blood pressure to what might be dangerous levels. Do you take the heart medicine digoxin? Then avoid black licorice, because this combination has been associated with irregular heart rhythms and heart attack. And black licorice is not a good choice if you are taking diuretics to help control your blood pressure either. Muscle pain, weakness, and paralysis can result. Okay, maybe you don't even like black licorice, but let's say you are taking blood pressure medications. If you try to reduce your sodium intake by switching to salt substitutes in your diet, this can lead to an overload of the element potassium. Consequences range from nausea and vomiting to muscle cramps and even heart attack. Do you eat a lot of vegetables, especially green, leafy vegetables like spinach or lettuce, or vegetables with edible flower buds like broccoli, Brussels sprouts, or cauliflower? These are all high in vitamin K. If you are on a blood-thinning medication, any changes in the average amount of vitamin K you eat in a week can cause problems. If you start eating more, your prescription may lose its effectiveness, increasing your risk of blood clots, heart attack, and stroke. If you start eating less, excessive bleeding can result. Then there's grapefruit juice. Remember potentiation? 0 + 1 = 2, where something with no side effects of its own can magnify the effect of something else. Grapefruit juice boosts the effect of many different medications. This can produce dangerously high levels of the drugs you are taking in your bloodstream. These include certain medications to treat high blood pressure, others for cholesterol control, some cancer drugs, psychiatric drugs for anxiety, bipolar disorder, and epilepsy, estrogen, and a number of allergy medications. Do you include a lot of natural foods or herbal supplements in your diet? Many of these can interact with your medications too, and obviously combining alcohol with almost any medication is a bad idea. Drinking when you are taking antidepressants, prescription painkillers, or muscle relaxants is a really bad idea. Your heart rate may fall, your blood pressure drops, and your pulse slows, along with your breathing. Impairments in your thinking, judgment, and reaction time make driving an extraordinarily high-risk activity. Don't do it.